sublobar resection or performing a lung resection, in a smaller scale compared to a lobectomy is certainly important for several reasons. One is, patients with compromised lung function cannot tolerate a pulmonary lobectomy. Therefore, sublobar resection offers an alternative for those patients to be able to undergo surgical resection of their early stage lung cancer. The other important reason why sublobar resection should be studied and utilized is, it saves lung tissue, particularly in patients who have small lung cancers that are in a peripheral location. Saving lung parenchyma is important, particularly for patients who are active, who exercise, and want to maintain as much lung function as possible. And most importantly, we want to know the oncologic, comparison of sublobar resection to lobectomy in terms of local recurrence rates and overall survival. And as we'll discuss soon, the most recent studies have demonstrated a very comparable outcome for sublobar resection compared to lobectomy for patients with small peripheral non-small cell lung cancers. The most important impact of sublobar resection it's been determined that it's essentially equivalent to a lobectomy, where you remove the entire lobe in patients that have tumors that are 2 centimeters or smaller. This is very important information, and it should guide surgeons when they discuss lung surgery with patients with early stage lung cancers. Segmentectomy and wedge resection are the two most commonly performed sublobar resections. So those are the two types of sublobar resections that most surgeons will perform for the small peripheral tumors. It's important to patients who as I said earlier, are active, want to maintain as much lung function as possible. And for patients with lung dysfunction, such as COPD or emphysema, these patients often have limited pulmonary reserve. So performing a lobectomy would subject them to significant postoperative complications and possibly respiratory failure. So it is an important concept which all thoracic surgeons should be aware of and able to perform these procedures. When we perform this, essentially this is a large review. We pulled papers that compared sublobar resection to lobectomy over several years. We looked for high impact studies. Some of the studies were single institution retrospective studies, but there were, I think, 3 critical randomized controlled clinical trials that were multi-institution, and these really are probably the most significant studies that sort of guide our clinical practice.